Okay, guys, it is 1/7/2021, RT210 class, and we are in the B section now. We just completed the RT210A, which was measurements and terminology. We just got finished with that lesson. For the most part, everybody did well on exam. Like I said, that was one of the easy exams to get that out the way, but that does not mean that you don't have to remember what you learned from that one. You're going to always have to reach back and use these conversions. You'll have to reach back and use some of these abbreviations, understanding these root words, suffixes, and prefixes, all the way through respiratory. All right. Today, we're going to jump into cardiac A&P, the anatomy and physiology of the heart. Again, I told you, you are considered to be respiratory excellence. You are a cardiopulmonary specialist in some hospitals. The heart and the lungs work hand to hand, and you can't have one without the other. The only way that you can make sure you're giving the proper therapy to somebody is to make sure that both systems are working good. And not only those, but also the liver and the kidneys. So, because the kidneys play a big part in the fluid intake, okay? So we have to keep in mind the heart and the lungs, they go hand in hand. And you're going to learn so much about both of them and in helping you enhance your understanding of respiratory therapeutics, okay? All right, yesterday's exam was one question on there that asked about temperature. If you put 98.6 Fahrenheit or 37 degrees Celsius, you got credit, okay? So if it said you was wrong and you put 98.6 and it said you were wrong, I added 5 points to that test. So don't worry, okay? I always look over my exams, everybody's exam, when it's over with, to make sure there was not a foul question in there or something that got keyed in wrong, okay? So you don't have to worry about it or email me 100 times about it. I'm going to already be checking. Okay, the same exams have been going over and over and over again. All right, let's go over some of the objectives for cardiac A&P. Pull up the lesson plan. Can y'all see my screen? See it? Lesson plan?
Yes.
Okay. All right, so this is what we're going to learn. And like I said, this is fast paced. We're going to talk about the heart. We're going to talk about the blood flow through the heart, the components of the blood. We're going to get into all of the cells, a lot of the cells in the blood, part of the cells that carry the oxygen and the defenses. We're also going to talk about the different chambers and valves of the heart, making sure you understand the way it's supposed to go and the pressures that are involved with this. We're also going to get into EKGs, electrotracing, electrocardiograms. And we're going to have to, in the lab for this one, you'll have to be able to put all the leads on, the pericardial leads, 12 lead EKG, and be able to tell me where it's placed. For example, lead 1, or V1 as it's called, is 4th intercostal space to the left of the sternum. V2 is 4th intercostal space to the right of the sternum, and then so on. So you'll have to know that, say that as you're doing it in the lab in order to get credit for the lab. Please go ahead and be looking at the lab information in the lab book for this section. Cardiac A&P in the syllabus tells you what books and what chapters to read, but over on the right-hand side, it talks about the lab book. That lab book tells you what page to look at. It might even have a couple of questions for you to answer, because that's going to ensure that we understand. Hey, how you doing? Ms. McIntosh? Yes, sir. Okay. Thank you. All right, thank you. And so you're going to have to understand how to utilize the EKG and where to put all of the places. We're going to talk about the waves of the EKG. You can go ahead and log into Canvas. Huh? Okay, yeah, you can use your phone if you can log into Canvas from your phone, but we're going to be on the Zoom. And it's being recorded, so whatever you don't get, you can go back and look at. Yeah, so we're going to have to understand where to put these leads and how they read the heart, because we're going to look at the wave. The EKG wave, which starts with the P wave, QRS, and the T wave. You're going to have to know what each one of those waves represent. What is the pressure at that wave? What is it called? There's a lot of AKA and AKA this and AKA that for the heart. For instance, when the heart contracts, that's also known as systole. It's also known as depolarization, also known as squeeze or contract, right? You may see it any one of those ways. So you got to know what they mean, all right? We're going to know what the EKG is doing at the physical level when you see it beating, the mathematical level, which is the digital one, right? And then you also have the cellular level. What electrolytes are going in and out of the heart cells to make this depolarization or this repolarization? So it's a whole lot of information, okay? So you have to stay dedicated and on top of it. So let's take a look at some of their objectives other than what I said. The student will be able to describe the contents of the blood and give the normal ranges for proteins, energy molecules, and electrolytes. See it, baby? Okay, once you get into Canvas to our class, go to modules, and then you'll go down to the second module. I think it's the second or third. It says RT210B, Cardiac Anatomy, A&P. Once you open up that one, you'll see McCarthy's Zoom link. That's what you'll hit, and then I'll let you in. All right. Electrolytes. So think about not only the blood flow through the heart, but we have an electrical flow through the heart. It doesn't just beat out of nowhere. There's electrical stimuli that happens in the heart. You're going to have to tell me, where does it start and what is the path of the electrical stimulation, and why electrolytes are so important. Because if you don't have, proper electrolytes, then you don't have proper conduction of electricity. Okay? So it's very important. I told you, once we get this lesson, you're going to think twice about what you put in your mouth, because your heart is working overdrive and has been beaten millions of times since you've been alive. Okay? Don't take it for granted. You're also going to be able to define erythrocyte, leukocyte, intravascular, interstitial, and intracellular, which we talked about that already in our term. We talked about there's fluid, or three types of fluid in the body. You have intravascular fluid, which is fluid within the vessels, which is our veins or arteries and capillaries. Then you have interstitial fluid, which is fluid that's found in between, because interstitial or inter means in between the cells. And then intracellular means inside the cell. Okay? You're going to tell me the purpose of the blood. It's many, many purposes. Your oral exam is going to ask you, what is the purpose of it? Give me 4 of them. It might be 4, 5, 6, 7 of them. But all they ask you for is 4 of them. Give me 4 examples or 4 purposes of a human blood. Okay? Describe the location of the heart using your terminology. Is it supra, sub, to the left, lateral, anterior, posterior, those type of terminology. Describe the blood flow, what we just said. Describe the types of blood vessels. You have 3 types of blood vessels, 2 main ones, arteries and veins. And then you have capillaries that meet in between, okay? Capillaries that meet in between the vein and the artery, all right? You can think of it as little fingers. Capillaries are like little fingers that intertwine. You have an artery over here and a vein over here. They meet together in the capillary beds. That's where they exchange gases at the tissue level. Okay? All right. Let me see where we're at. Monitor blood pressure and pulse. You're going to be doing that as well in your lab, being able to take each other's pulse manually and doing blood pressures manually. Don't forget, on lab day, you must be dressed out completely. Make sure you have your stethoscope, your pulse ox probe, all of that stuff that you got. You need to be in your lab coat, fully dressed out. Taking in consideration your hair and your nails that we talked about. If you have any questions on that, you can ask me later. All right. Describe the pathway of the electrical stimulation. That's what I said already about the electrical. Just like a lightning bolt. Whenever you see a lightning bolt, it starts at the top and it goes down to the bottom. Well, your heart does the same thing. Electrical or electricity moves through the heart the very same way. Number 10, describe what occurs during repolarization and depolarization in the tissues on the EKG tracing and mechanically in the heart. So what they're saying is during depolarization, I said that's the same thing as squeeze, right? AKA squeeze, AKA systole. When it depolarizes, when the heart depolarizes, it squeezes. So they're asking, what's happening to the tissues? The tissues are contracting. What's happening on the EKG tracing? That would be the QRS complex, the big little QRS. That's depolarization of the ventricle, right? And then mechanically, what's going on in the heart? And a question, huh? Yes. Okay, go to modules. And Brittany saying she can't hear. Can everybody else hear me?
Yes. Yes.
Everybody can hear me, so I don't know why she can't hear me. Brittany, you might have to turn your computer up. My share audio is on because y'all can hear me. Headphones, yeah. Connect your at the bottom of your screen, Britt. Or she can't hear me, so let me see. I'll send her a message right quick. All right. After you go to your modules, you'll go to the second module, which is RT210B, cardiac. Did you go to modules yet? promptly when you know. All right. So, Brittany, I hope that helped you as far as hearing. All right. So, describe the difference or what happens during systole and diastole. Remember that the blood pressure. What's the normal blood pressure? What does anybody remember what the normal blood pressure is? When you take somebody's blood pressure, what's the normal?
120 over 80.
120 over 80. So what is the unit of measure we said we use for that?
Millimeters of mercury.
Millimeters of mercury. Millimeters of mercury. So the 120 is the systole. That's the pressure in which the heart or the ventricles contract or systole or depolarize, right? When the heart does that, it exerts a pressure. That's the systole or systolic pressure, and that's 120. The diastole is the relaxation. When the heart relaxes, the pressure in the heart at which it's relaxing is the diastole, which is AKA repolarization or AKA relaxation. Okay. So, and we'll get into that more as we go. But that's what's going on during systole and diastole. Systole is contracting and diastole is relaxing. All right. Differentiate basic non-threatening arrhythmias from threatening EKG waves. The EKG waves we want to learn, there are 4 deadly rhythms. You see one, you need to act, call code blue, start CPR, and possibly shock or defibrillate. Okay, when you see these 4 deadly rhythms. But there are also some other rhythms that are not deadly. They're arrhythmia because that means they're not in rhythm. Remember, a or and before a word means not, okay, or without. So it is without a basic rhythm. It's just kind of everywhere. Some of them are deadly, some of them are not. But describe the basic EKG wave. We talk about normal sinus rhythm. We'll talk about tachycardia, bradycardia, supraventricular tachycardia, ventricular tachycardia, VFib, VFib. We'll talk about PEA, which is a when you have a heart rhythm, but you don't have a pulse. It looks good, looks perfect on the screen, but there is no pulse, right? And so that is a deadly rhythm, okay, because the patient is literally dead. The heart is not beating, you're dead. All right, and then describe some different diseases like hypertension, which is high blood pressure, right? When we talk about blood pressure, we don't say his blood pressure high. We say he has hypertension or hypotension. Remember, hyper is high or above, and hypo is lower than normal value. Okay. MI is a myocardial infarction, which is a heart attack. CHF is congestive heart failure. Cor pulmonale. Cor pulmonale is right-sided heart failure. You won't have to worry about ASHD, but ischemia, which is lack of blood flow to an area. Ischemia is lack of blood flow to an area, and then shock. These are some diseases or conditions, cardiac conditions that can lead to death if not treated properly. Okay, so you see, there's a lot you're going to learn in this lesson here. Okay, we're going to do lecture 3 days, then your exam. Your exam will be the same day as your lab, and this is a pretty big lab because we have to do blood pressure, pulse, respiratory rate, right? It's pretty simple. But then the EKG part, right, takes a little time, and it's a lot of students. So if you're alpha group, make sure you're here at 1 o'clock on that lab day. And if you're omega group, be here at 4 o'clock. Not just any time in between, because you got to take your exam and do the lab in those couple of hours. All right. All right, here we go. So I will be adding you to one of these groups. You have to be.
And I had it downloaded already.
So when you go back to the, after you got it downloaded, go back to and just hit the Mr. McCarthy Zoom link and just push next or whatever needs to be done, so it'll load. It should load for you. When you go back to the module and collect Mr. McCarthy's Zoom link, hit it, and it should say launch. But during the break, I'll talk to you about the two groups that we have. We have an alpha group, which is 1 to 3, and an omega group, which is 4 to 6. You have to be in one because we have so many people. We can't all be here at one time. So when we do our lab and exams, our lab and exam is at those specific time for the specific team. So there's one more other student that's supposed to be here that's joining late, but I haven't talked to her. So I'm like, whatever one you pick, she got to be in the other one to make it even. But Mr. McCarthy's Zoom link, just hit it and follow the prompts to launch on. All right, it's 1:28, guys. They say it's 1:30. Let's go ahead and take a 10-minute break. 1:30, come back at 1:40. I'm going to pause the recording. We're going to take a 10-minute break, come back at 1:40, and we're going to start with the blood. Hey guys, I'm back. We're back from break. My mic was off, okay? We're back from break. We better go ahead and share my screen back to the lesson plan to get started. I'll be going from the lesson plan to the PowerPoint, kind of back and forth, just to give you a better visual. It's the same information, but I go back and forth when I do that, okay? Now, don't forget your team. Let me go over this right quick. This is the teams, Alpha and Omega, because we're going to lecture today, which is Thursday. We're going to lecture Friday and Monday, okay, for 210B. And then Tuesday, which is the 12th, you come to class for the test and the exam, right? So if you're Alpha group, you'll be here at 1. And if you're Omega, you need to be here at 4. So we got a lot to do in a small amount of time. You get all it knocked out, you can go home, okay? So don't forget, that's the groups there. All right. We found the lesson plan. All right, can y'all see the blood? It says the blood. Okay, you see it? Everybody can see it. I'm about to go and get started. All right, the blood. That's the first thing we're going to talk about is the composition of the blood. First thing about the blood is the first part of it is plasma. It consists of plasma and cells. All right. Information about the plasma is about 90% water, 10% solutes. Okay. And your solutes like proteins, energy molecules, and thus for electrolytes. Okay, those will be the solutes. Now let's look at the proteins. The proteins that are involved or in your blood is albumin. And albumin is what we use to help thicken the blood. It naturally does it, but if somebody's blood is really, really thin in the hospital, we can give them some IV albumin. Globulin. Globulin includes antibodies, right? It gives us antibodies that helps notice when a foreign invader comes into the body. All right. Globulin is been given a lot, testing it with the COVID patients to help them have more antibodies to notice a foreign invader and to treat it or to defeat it, right? Fibrin and prothrombin, those are used for clotting. If you don't have good clotting, if I cut you, you'll bleed to death. All right, the blood will just continue to pour out the cut. So you have fibrogen and prothrombin that will go, as well as platelets, and they will go to that cut and help clot the blood so that it does not continue to pour out. Okay. Then another solid we have or group is molecules, the energy molecules, which is glucose, lipid, and amino acids. That's what we use to burn, right? We burn carbohydrates, which turns into glucose, which is sugar. We also burn lipids, which are, what are lipids? Somebody tell me.
Fats.
Fats. And then we have amino acids. All those things are using, like you learned in high school about the Krebs cycle, the mitochondria, all these energy powerhouses are using these molecules to help you live every day, okay? And the byproduct of this energy metabolism is what? What did we say it was? What's the waste product of metabolism? See if somebody carbon dioxide. Excellent. Carbon dioxide is the waste product of metabolism. That's why you exhale it out every breath, okay? Now, electrolytes. These are the electrolytes you're going to have to memorize. You will have to memorize your electrolytes. And these are very, very important because if you don't have the proper amount of electrolytes, we don't have depolarization and we don't have repolarization. If we don't have that, your heart doesn't beat, okay? If you don't have depolarization, then your heart is not beating, okay? So it's very important that you take in the proper amount of electrolytes. Now, what you have to memorize, you don't necessarily have to remember the abbreviations, but it'd be good to know it. But you do need to know the word, which, like, for instance, sodium is 135 to 145, and the unit of measure is milliequivalents per liter. Everybody say that. Milliequivalents per liter. Say it. Milliequivalents per liter. Okay, you got to know that because if you are taking your oral exam and the instructor says, "Tell me the normal sodium," you say, "Oh, I got that, 135 to 145." And they say, "Well, 135 to 145, what? Millimeters of mercury, centimeters of water, what? Milligrams?" You got to know it's milliequivalents per liter. If you don't know that, it's wrong. Milliequivalents per liter. All right. Chloride. Chloride is 96 to 105 milliequivalents per liter. 96 to 105 milliequivalents per liter. Now, I'm also going to give you guys a normal value sheet. It looks like this. Normal values, and sometimes they're off just a little bit, but either one is fine. These normal value sheet will follow you all the way through your respiratory career. You don't have to memorize all of these for this class, but all of these will are formulas that you will have amassed in your time here at Concord. Some of them we learn in 210, some of you will learn in 220, some of you will learn in 240, 250, okay, 230 or whatever. So, but we give it to you now in 210, so you'll have your foundation of your normal values, okay? So for instance, on here, the potassium and the sodium and the chloride, pretty close, okay? But we're going by this the most. So if you see one that's off by a 0.4 or something like that, don't worry about that, okay? Either one is fine. So I will get this out to everybody this evening sometime. All right, go back to it. So we're talking about our electrolytes. Bicarb, which is HCO3, is 22 to 26 milliequivalents per liter. 22 to 26 milliequivalents per liter. Potassium, which is K, is 3.5 to 5 milliequivalents per liter. So who can tell me, where do we get most of our potassium from? Anybody in the chat, whenever I ask a random question, like anybody can say it. Where do we get our potassium from?
Greens,
Huh?
like vegetables, greens,
Yeah, green leafy vegetables and what fruit? Bananas.
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 Good, good. So that's how we get our potassium. You're gonna know, when you understand that potassium and sodium are the two most important electrolytes. Potassium and sodium are responsible for depolarization and repolarization of the cell. Okay, if you don't have them, you don't have a heartbeat. Okay. When you're studying, I want you to look at and find out what the terminology is for elevated levels of these. Like elevated sodium would be what? Hyper or hyponatremia, or the too high potassium or too low potassium is called something. If the calcium is too high or too low, it has a terminology. So I want you guys to be figuring that out and be able to tell me that tomorrow, okay? The first thing I want to know is I'm going to say, okay, if somebody has a very high sodium, what is that called? All right? And you can find that in your reading, or you can find it online, or however you want to find it, okay? But you need to know that terminology. Calcium, which is Ca, it is 4.25 to 5.25 milliequivalents per liter. And then magnesium, Mg, is 1.4 to 2.2 milliequivalents per liter. These are your basic electrolytes. You will have to memorize these, I promise you. Right? I promise you. You may have one and it has a different unit on the set. If I say, what's the normal bicarb? And the answer says, one answer says 22 to 26 milliliters. And then another one says 22 to 26 milliequivalents per liter. You got to know which one is right. That's why it's very important to understand that suffix. The unit of measure is extremely important. Okay? Now, one way that I found to help me remember at least the potassium and the calcium. How many bananas come in a bunch when you buy some bananas? Well, I don't know if I got that many. I was thinking about 3.5 to 5. With little small bunches, about 3.5 to 5 bananas. Okay, that's how I help myself remember potassium. About 3.5 to 5 bananas, right? And then calcium. Where do we get our calcium from? Milk is one way, right? Milk. Okay, so how much does milk cost for about a gallon?
$3.
Or $3. Look at the value. Look at the value. I'm trying to do this so you can understand that value. About $4.25 to $5.25, right? Around that range. That's about how much a gallon of milk costs, depending on where you are. So about 4.25 to 5.25 milliequivalents per liter. So that's just one way. You're going to find a lot of little tricky ways to help you memorize things, and that's fine. Okay, we got a little I got a few tricks to give you, and you might have some that you learn to help me. Okay, help the class. So then you also have phosphates, sulfates, and organic acids. But the ones you need to memorize are those in the blue: sodium, chloride, bicarbonate, potassium, calcium, and magnesium. They will be on your exam. They will be on your final exam. They'll be on your oral exam, and you'll have nothing to look at, right? They'll just pull up a card and say, tell me the normal potassium. You got to know it. You got to know it. Okay? All right. Now, that was the plasma. That was the composition of the plasma. What about the cells? The actual cells of the blood. Well, one type of cell is called erythrocytes, which are the red blood cells. The red blood cells. That's the erythrocytes. The red blood cells are produced where? Where do we make the red blood cells?
In bone marrow.
Bone marrow. Good. Produced in bone marrow. Is that on your note-taking guide? You need to make sure you write it. Produced in the bone marrow. What's very important about the red blood cells is they contain what's known as hemoglobin. The hemoglobin. The hemoglobin is what attaches to oxygen. Okay? When you breathe in oxygen, when that gas exchange happens between the capillary and the alveoli, the oxygen snaps to the hemoglobin. Hemoglobin is almost magnetic. It just goes and it picks up all the oxygen it can pick up, okay? And carries it to the body so it can release it to your tissues, all right? Once the hemoglobin becomes supersaturated with oxygen, the blood turns what color? When the hemoglobin is full of oxygen,
red, bright red.
Bright red. Bright red has picked up all of that oxygen. Now it's bright red, headed to the body to give it to the body. But once it gives it to the body, it no longer has oxygen and it turns what color?
Blue.
Blue. So hence the reason why we have the two different colors on the board about the venous blood and arterial blood. The blood in the veins are deoxygenated. The blood in the artery should be very oxygenated, okay? But we'll get to that. Now, what's some important things about hemoglobin? The normal hemoglobin amount is 12 to 15 grams per deciliter of blood. You got some, male and female are different, but we use a roundabout number, 12 to 15. That's the normal hemoglobin for both male and female together. 12 to 15 grams per deciliter of blood. 100 means deca, per deciliter of blood. What's the normal hemoglobin? What's the normal hemoglobin?
12 to 15 grams per deciliter of blood.
I just said. I'm not trying to trick you guys. I'm just making you say it back to me, huh? Deciliter. 12 to 15 grams, okay? Normal hemoglobin is 12 to 15 grams. It's usually higher in males than it is in women. Somebody tell me one reason why it would be higher in men than it is in women. Let's see, Courtney. Courtney, can you tell me one reason why it's higher in men than women?
Is it because of hormones like testosterone or?
Kinda, but not what I'm looking for. But you're on the right tracks. What about you, Brittany? What about you, Heather? Gotta unmute your mic. All right, anybody? Somebody tell me. I don't know who's. That's why I tell you.
Because
more muscle mass?
Huh?
Is it because they have more muscle mass?
No, not the muscle mass, but you're on the right track as well.
Is it because males are normally larger than females?
That's true, but what about the male is larger? Think about where it's made.
Their heart.
Where do we make? What are red blood cells made?
In the bone marrow.
In the bone marrow. So men have bigger bone mass than women. And the red blood cells are produced in the bone marrow. Okay. And so since we have bigger bones than women, then we produce more red blood cells. There's another reason, is because women have a menstrual cycle and you lose a lot of blood cells every month, right? And so that's why those are two reasons why males have more red blood cells than females. Okay. All right. Hematocrit. Now, hematocrit is a number we use to kind of get a roundabout number about their hemoglobin. Instead of saying he got exactly 14 grams or she has 12 grams or whatever, we use what's called hematocrit. Hematocrit. Okay. We do like an H&H. When you ever hear that in blood work, they say, let's get an H&H, they're talking about hemoglobin and hematocrit number. Okay. To find the hematocrit, it is approximately 3 times the hemoglobin. The hematocrit is approximately 3 times the patient's hemoglobin. Okay. So Jessica, if Mr. Johnson has a hemoglobin of 15, then what's his hematocrit?
45.
45. So Jessica, hematocrit is 3 times the hemoglobin. And I said the hemoglobin is 12 to 15, right? That's the normal value for hemoglobin for male and female. So if I told you Mr. Johnson has a hemoglobin of 15, then what's his hematocrit? 15 times 3, okay? If Mr. Johnson has a hemoglobin of 12, what's his hematocrit? Which is what? 36. All right. Now, remember this one thing, guys. Hematocrit is written in percent. See that? The normal hematocrit is about 40 to 50%. Okay? So if I say, what's Mr. Johnson's hematocrit, you got to answer that in percent. So if I said he has a hemoglobin of 15, what is his hematocrit? Well, that's 15 times 3, which was what?
45%.
45. So 45%. Okay, 45%. That's how you find hematocrit. All right. Number 4, we talked about hemoglobin. It's what carries the oxygen. So this is the important things about hemoglobin. Hemoglobin is found in the red blood cell, right? It's a protein that's found inside of the red blood cell that attracts oxygen. It carries oxygen. The amount that you should have of the hemoglobin is about 12 to 15 grams per deciliter of blood. All right. The hemoglobin is usually higher in males than it is in females. And to find the hematocrit, we simply multiply the hemoglobin times 3, and that answer is in percent. How many red blood cells do we have in the body per cubic millimeter?
4.2 to 6.2 million.
Thank you. Are you seeing it? Or are you not seeing it in your note? Oh, okay. Yeah, don't be scared to say it, y'all. Y'all gotta not be timid, because I want to make sure you have it. Make sure it's not missing on your paper. So we have 4.2 to 6.2 million red blood cells for every cubic millimeter of blood. That's a lot of red blood cells. Okay, a lot of the cells, and they do so much work. So that's the first type of cell, the erythrocyte, which is the red blood cell. You're going to need to know that. Like if I'm asking a question, the question may say, what is it? What are red blood cells called? You need to know that they are erythrocytes. Erythrocytes. Okay. Number 2, the soldiers of the blood, the white blood cells, WBCs. They are the soldiers of the blood, and they are called leukocytes. Leukocytes are the white blood cells. Okay, and those white blood cells are broken down into a few different types. Okay, the white blood cell, which is also known as the leukocyte, are the soldiers of the blood. Whenever there's a bacterial infection, your white blood cell count is going to jump up. If I get some blood from you, for instance, let's just say you come to the hospital and you have a fever. Okay, you got your febrile, short of breath, and the doctor wants to do a complete blood count on you, CBC. Well, the normal white blood cell count is 5 to 10,000. Okay, and if I get your blood and I see you got a white blood count of 25,000, you got a bacterial infection, because they only respond to bacterial infections. White blood cells only increase in the presence of a bacterial infection. Okay, so this is how you have to learn, how do we diagnose and how do we treat. Because if I see that you're febrile, something's going on, right? You're sweaty, you're coughing, your breath sounds are wheezing, you got all kind of stuff going on. Well, let me see. Get a blood count. His white blood count is way out the ceiling. Then he has a bacterial infection. And what do we treat bacterial infections with? Antibiotics. And so that lets us know the difference between a virus or a bacterial. Because you might be febrile and all that, but your white blood cell is either normal or low. That means it must be viral. Whatever they have must be viral. So don't waste time with antibiotics, right? Antibiotics do not treat viruses. Okay, so the leukocyte, also known as the white blood cell, is broken down into 3 or 4 different types. You have the eosinophils. Eosinophils protect the body from what? Parasites and allergens. Allergens, things that you're like pet dander and pollen, stuff like that. If I get your blood count, so say you are in there sneezing, come in the hospital coughing, eyes are puffy, watery, you're sneezing, coughing, and I get a blood count on you, I expect to see your eosinophils to be high, because that means you have an allergy going on. You have parasites and allergens in your body. And so now the eosinophils increase to help fight those, okay? The eosinophils fight parasites and allergens like pet dander and dust mites, pollen, okay? Then you have the basic, think of it like this. The leukocytes are the military, right? In our military, we have Navy, we got Marines, we have Air Force, right? Army. Well, the white blood cells is the military of the blood, okay? You have eosinophils that specialize in killing allergens and parasites. You have basophils that secrete heparin. Does anybody know what heparin does to the blood?
Is it
thin it? Good. It's a blood thinner. It's a blood thinner. So we use that to thin out the blood if we need to thin out the blood. Then we have mononuclear monocytes, that also known as phagocytes. What do phagocytes do? Who can remember from high school? What does a phagocyte do?
They eat up the...
Excellent. Good. They ingest foreign materials, right? If you have some type of foreign materials in the blood, those phagocytes will just encompass it and close it and eat it, okay? So we got the phagocytes on their job. Then we have lymphocytes. Lymphocytes. The lymphocytes function in the immune mechanism, right? If you see lymphocytes are higher, there's an immune system going on. That's your immune system, your lymph nodes. You ever had a cold or bacterial infection or some type of infection and your lymph nodes were swollen in your neck, and the doctor will feel your neck to see if you feel any lumps he's feeling for, or she's feeling for lymph nodes. If they're higher, that means that they are full of bacteria. They're full of disease, right? They're trying to eat it up to keep it from you. Okay, that's what the body's trying to do. The lymph nodes can be found in the groin area. They can be found in your neck, under your armpits, right? Those are all areas where the lymphocytes can build up. They function in the immune mechanism, right? Then you have the polymorphonuclear neutrophils, or just neutrophils, okay? Neutrophils. And then finally, what's the count for white blood cells? White blood cells.
5 to 10,000.
10,000, good. 5 to 10,000 is the normal count for white blood cells. If it's between 5 and 10,000, the patient does not have a bacterial infection. They don't have a bacterial infection. That don't mean they don't have a virus, but they don't have a bacteria, okay? 5 to 10,000. So you want to see that when they say, hey, what's the normal white blood count? 5 to 10,000, right? And knowing this blood, guys, is the first step in knowing what to do, okay? I got to get inside of you and get a little bit of that blood. I need to get that blood for this complete blood count. I need to get some arterial blood so I can find out your ABG, which is your blood gas status, your acid-base status, your oxygenation status, and get all of these things from your human blood, okay? And then finally, about the blood, platelets. What do we say platelets are for?
Clotting.
Clotting. Platelets play a role in clotting. You should have 150,000 to 400,000 per cubic millimeter of blood. That's how many platelets should be in the blood. So anybody, what is the disease of somebody who has, let's put it like this. You might not know, but I think some of you may know. If a patient has chronic low platelets, like 50,000, right? Should be 150 to 400,000. But say they have 40,000, 50,000 all the time. What's the name of that disease? Anybody think of that?
Is it anemic?
It's anemic, yeah, but there's a certain name for the disease. Anemic would be pretty much low blood, period. Red blood cells.
Sickle cell?
Not sickle cell, that's when the red blood cells are deformed.
Okay.
But you're close. When somebody's anemic, they have a low blood count, period. But I'm talking about just platelets. If the platelets are chronically low all the time, all their life, they have a disease known as, it's okay if you don't know, because I mean, I didn't teach it.
Leukemia.
Leukemia?
That's possible, but what I'm looking for is hemophiliac. Hemophilia or hemophiliac is somebody who has very low platelets. Therefore, if you cut a hemophiliac, they're going to bleed for a long time. They have to put extra pressure on their wounds in order to stop bleeding. A hemophiliac will bruise very easy. You bump up against them, just barely bump up against them, it's a bruise. But the platelets are so low, it's so thin and just nothing there to stop it. Just spreads under the skin. Okay? All right. Let's take another 10-minute break. And we're going to get into the blood that makes up the intravascular fluid. That's what blood is. The fluid inside of a vessel is known as intravascular, right? We got 3 types of fluid in the body. Intravascular, which is inside the vessels. Interstitial, which is in between the cells. And intracellular is inside the cell. You want to pause the recording while we take a 10-minute break? Okay. We'll look at that when we come back. I'm going to pause the video, and we will come back at, let's just say, come back at 25 after. 2:25. This is the PowerPoint. Again, the PowerPoint is available to you at all times. It's in the module. You can look at it at any time. But I'm going to kind of go through here and kind of recap, not slowly, but because I've already talked about certain things. This is exact same information, just with a few pictures. All right, the human blood, we said that's the life oil of the body. It consists of the erythrocytes, which are red blood cells, the leukocytes, white blood cells, platelets, right? And where is that at? The blood is the fluid that makes up the intravascular fluid. 3 types of fluid in the body. That's one of the oral exam questions that a lot of students forget, okay? Fluid is found in 3 types of areas. You got intravascular, which is the blood that's inside vessels, right? Interstitial is in between the cells. Fluid that is in between cells is called interstitial fluid, interstitial. And then intracellular is fluid that's found inside the cell, like cytoplasm. That's inside the cell. Say the blood is 90% water, 10% solutes. All right, now, what does the blood do, right? What is the main purposes of the blood? Make sure you highlight this or write it on, notes or whatever. Transport the respiratory gases, right? What are the 2 respiratory gases that the blood transports? Carbon dioxide and oxygen. Because you said, and what part of the blood carries oxygen? Anybody? What part of the blood carries oxygen? Anybody in virtual? Anybody? Brittany?
Red blood cells.
Red blood cells. Yeah. What part of the red blood cells carry oxygen? We just learned it. What part of the blood carries the oxygen?
Hemoglobin.
Hemoglobin. The hemoglobin. And so not only does it carry oxygen, but the blood has to carry the carbon dioxide that is made. So it can go back to the lungs and you can exhale it out. Okay? So that's what that means by transporting the respiratory gases. The respiratory gases are carbon dioxide and oxygen. The blood carries both of those in order to give the body the oxygen and rid the body of carbon dioxide. It also circulates the defenses, which are your leukocytes, right? Circulates the defenses. Now, that's your leukocytes. What part of the leukocytes would be there for allergens? Which part of the leukocytes would be fighting allergens?
Eosinophils.
Eosinophils, thank you. Eosinophils, okay? And then what is the normal leukocyte count? The normal
5,000 to 10,000.
Good, 5,000 to 10,000. Notice I didn't say white blood cell. It may say leukocytes. You got to know that's the same thing. Okay, good. Another thing that the blood does, it gives nutrients to the cell. The nutrients, like the vitamins, stuff that you take in, vitamin D and vitamin C and all of those iron fortified foods, fiber, all that kind of stuff. Those are the nutrients that your body absorbs when you eat. It gets into the bloodstream and the blood carries it all over the body, the nutrients. It also removes waste from the cell. Removes waste from the cell. The blood is responsible for clotting. Clotting. And then finally, to provide the body with electrolytes. These are the purposes of the blood. One of the oral questions are going to say, tell me the purpose of the blood. You got to be able to tell them at least 4 of them. And you need to know what the blood does. What all is it responsible for? All right, we said that the red blood cell count is total between men and women, right? Red blood cells are more in men than it is women, but the roundabout, we said, was 4.2 to 6.2 million. So everybody look at my screen. How we got that is by saying the lowest in females, which is 4.2, to the highest in males, which is 6.2. That's where we got that normal form. The normal red blood cell count is 4.2 to 6.2 million, right? Per cubic millimeter of blood. 4.2 to 6.2 million when we do both male and female. We take the lowest number for female and the highest for male for our range, okay? You already told me some of the reasons why the red blood cells are higher in men than they are in women, okay? Now, for both male and female, the total leukocyte count or white blood cells is 5 to 10,000. 5 to 10,000. All right, here go your values again for your electrolytes. Make sure you know them like the back of your hand. All right. So let's recite them. Let's see here. Michaelin, tell me what the normal sodium is.
135 to 145 milli.
Milli?
I can't remember. Hold on. milli equation. I can't remember. Hold on.
Milli
Equivalents per liter.
There
Yeah,
you go.
milli equivalents per liter.
Milli equivalent per liter. Good. Okay. Stephanie, what's the normal chloride level?
It's going to be 96 to 105 milliequivalents per liter.
Excellent. Talicia, what about the normal bicarb?
It's going to be 22 to 26 milli equivalent per liter.
Good, good. Stephanie, what about the normal potassium?
That's going to be 3.5 to 5 milliequivalents per liter.
Good. Did I call you already? I'm sorry. Your names flip-flop when y'all say something. Jessica, what about the normal calcium?
That's going to be 4.25 to 5.25 milliequivalents per liter.
Good, good. And Kelsey, what's the normal magnesium?
1.4 to 2.2 milliequivalents per liter.
Good. And then what are the other three, Lori?
It's going to be phosphate.
Good. Sulfates, phosphate, and organic acid. You don't really see that much. As long as you know these, guys, you must memorize the electrolytes. All right. Hemoglobin, once again, we said hemoglobin is the carrier. It carries what? What does hemoglobin carry?
Oxygen.
Oxygen. Hemoglobin carries the oxygen. All right. The estimated amount of hemoglobin is 12 to 15 grams for male and female. All right, this is a picture here, guys, of the action, the hemoglobin in action. This whole red sickle here is the red blood cell, this little disc. This is the red blood cell. Okay, this is the red blood cell. These molecules inside of here are hemoglobin. And the hemoglobin attached to these little oxygen molecules. So what they're saying is as the oxygen enters into the blood, it is picked up by the hemoglobin, okay? And then it bonds to the hemoglobin and travels to the tissue level. When it gets to the tissue, the oxygen is released from the hemoglobin. The hemoglobin lets it go and gives it to your feet, gives it for your arms and legs and hands, right? The tissues, because your tissues need oxygen to survive, okay? Every part of your body has to have gas exchange. It has to get good oxygen in and give up the waste product, which is what? Carbon dioxide. If carbon dioxide, good. If carbon dioxide starts to build up and it's not being released, that's called respiratory failure. They go into respiratory acidosis because we said carbon dioxide is AKA acid, AKA respiratory, AKA ventilation, right? AKA carbia, AKA capnia. Okay, that's how you have to be able to put these together. All right, now let's talk about the heart itself. The heart itself. This is the location of the heart. It is three things. It is posterior to the sternum. What's the next one?
Superior to the diaphragm.
Diaphragm, good. And the last one is to the left side. Okay? So let's say posterior to the sternum. So this is the sternum, right? This is the patient's sternum. This is Mr. Johnson, just in case you didn't know. This is Mr. Johnson. This is Mr. Johnson's sternum, the bone right across the front of the chest. So the heart is posterior to the sternum. That means it's behind, right? Behind the sternum. So the heart is behind the sternum, superior to the diaphragm, which the diaphragm is right here. So it's superior to the diaphragm, means it's above the diaphragm, right? And it hangs slightly to the what? Left, the patient's left. Don't forget, not your left, the patient's left. This is Mr. Johnson's left. This is his right. Okay? So that's the positioning of the heart in the body or inside the thorax. This is called the thorax. Okay? That's its location. You'll learn more about the diaphragm as we get into pulmonary mechanics in A&P. All right. The heart has some layers. I'm going to show you some layers of the heart, and then we're going to go back into the lesson plan. And the first thing is the heart sits in a sac. Okay? You can't really see it. It's kind of like a clear sac, kind of like cellophane on something you buy with cellophane on it. It sits in a sac. The sac is called the pericardium. Everybody say pericardium. Pericardium. Good. Now, it also has three other layers. Okay? The exterior wall of the heart. The exterior wall of the heart, right? The exterior wall. This is called the epicardium. Epicardium. Now, the heart's sitting in a sac called the pericardium, right? But the actual heart itself has an outer layer. This outer layer is called the epicardium. Then it also has an inner layer. This inner layer here is called the what? Endocardium. Okay, endocardium. And then it also has a muscular layer in the middle. This right here, this is the muscle of the heart. The heart muscular layer is called the myocardium. Excellent. Okay, that's the layers of the heart. It has a epicardium, it has a endocardium, and it has a muscular layer called the myocardium. Right? All right. Now, what? I want you to put it in the chat. You're thinking about what you learned into the first unit, about your suffixes. What would it be called if my patient, Mr. Johnson, if his endocardium is inflamed? Write that in the chat. If his endocardium is inflamed, what would that condition be called? You don't have to spell it right, and it might not be 100%. I want to see where your mind is using the chat privately to me. I want everybody in here to write something in the chat to me. Mr. Johnson's endocardium, his endocardium was inflamed. What would that be called if his endocardium is inflamed? Write it to me privately. Yeah, you chat to me, Just make sure you send it to me, not to everyone. That way, I want to make sure everybody knows the answer, not just copying other answers. Looking good. Good, Michaelin. Good, Cassidy. Good, Kelsey. Britt, you're right. I said inflamed, Brittany, but I need to know what's the name of the word when the endocardium is inflamed. Brittany, I need to know the word. Maria, good. Talisha, good. Talicia. Courtney, good. Stephanie, good. Lori, yes, inside the heart, which is the endocardium. If it is inflamed, what would the term be called? Write it in the chat. Yeah, it's close. All right, good. Endocarditis, right? Endocarditis, because itis means inflammation. So if the endocardium is inflamed, then that term patient is suffering from endocarditis. If the if the epicardium was inflamed, then it would be epicarditis, right? What if the muscle layer of the heart was inflamed? What would that be called?
Myocarditis.
Myocarditis. All right. Now, what about if the sac itself is inflamed?
Pericarditis.
Pericarditis. Pericarditis. See? Don't make it harder than it is. You're just using what you've learned. So those are three of the conditions that you could be suffering, your patient could be suffering from, right? Itis just means inflammation, right? Whatever it is, bronchitis is inflammation of the bronchioles, right? Endocarditis is inflammation of the endocardium, right? Pericarditis is the inflammation of the sac that the heart sits in, okay? So those are some things about the heart. I'm going to get deep into this heart. Now, we just learned the layers. You just learned the layers of the heart. Now, let's keep going. Now, the heart itself is made up of 4 chambers and 4 valves. 4 chambers and 4 valves. Okay? The chambers are the areas in which blood sits, right? Or where they load. They go from one chamber to another chamber via the valve. Okay? It's kind of like if you think about the door to your house. You go from or your living room, and then you go into another room through that door. Well, the living room and the other room would be the chambers, and the door would be the valve. Okay? You have 4 chambers and 4 valves. We have the right atrium, right here. Look at my marker on my on the PowerPoint. We have the right atrium. That's the first chamber. Then you have the right ventricle, which is the second chamber. You have the left atrium and left ventricle. Now, those are the 4 chambers. Right atria, right ventricle, left atria, left ventricle. Those are your 4 chambers of your heart. Now, those chambers are separated by valves. These valves are one-way valves to keep blood from going back the wrong way. Okay? You have a series of 4 one-way valves that ensure the proper flow of the blood through the heart. Okay? Now, we're going to look at this on the board because everybody's going to learn them. You're going to memorize them, and you're going to be able to recite it to me. All right? So let's look at this good old heart on the board. All right. Let's go a little bit farther. You can see it. All right. Y'all see that? Huh? I froze up on you. Is it moving now? Is yours moving? Okay. Now let me try it again.